Here is a possible scenario between a patient and a clinician. Well, Mr. and Mrs. Williams, nice to see you again. I've now had the X-ray report that shows that your right hip will require an operation to stop the pain that you're experiencing and allow you to live a normal life again. The waiting list is around 18 weeks at present, and I will arrange for you to be put on it. Any questions? Hello, my name is Lawrence Mudford, and I'm the patient representative for CPOC, the Centre for Perioperative Care, working from the Royal College of Anaesthetists. The example I've just shared highlights only one of a number of scenarios that are possible between patients and clinicians, but it helpfully leads us into the topic that I'd like to discuss in this short video: shared decision making. This may be a relatively new topic for some, as I'd like to unpack it a little so that we're all aware of how it can work to benefit both the patient's choice and how the outcome of treatment can be better managed by the clinician. Shared decision making at its heart is a conversation between two people, and it's a conversation which brings together what both know best: the clinician's experience, such as treatment options, evidence, risks and benefits, and what the patient knows best: their preferences, personal circumstances, their goals, their values and their beliefs. So let me replay my original scenario again, but try to incorporate what I think we mean by shared decision making. Well, Mr. and Mrs. Williams, nice to see you again. I've now had the X-ray report that shows that the pain and poor mobility that you're experiencing does come from your right hip. There are a number of options that you could choose. I would like to chat through these to help you understand what you feel would be the best option at this time. Then I have some leaflets that you can both take away to hopefully help come to a conclusion and a decision. But before we look at those options, I'd like to hear a little bit about you so that I can understand what matters to you, how this condition is affecting you, and what outcomes you would see and expect following any treatments that you may choose. You will have noticed that there were some key words and phrases that may perhaps have surprised you, but are central to shared decision making: options, choice, about you, and outcomes. Many patients don't realise that exploring both the options and choices can have benefits to their treatment. And of course, for some, even the recognition that they have choice may come as a revelation. As I mentioned earlier, while the clinician is the expert in terms of what options are available, the patient is master of their own circumstances, their preferences, and reason to opt for a certain treatment or not, and their perspective of life choices. This interaction is at the heart of shared decision making. The shared decision process should always allow the clinician to understand this important information and support the patient in choosing the best option for them. So how can that happen? I think there are two main aspects that are essential. Firstly, a way for the clinician to understand their patient's individual circumstances. We can use the title of About Me, where the patient can be supported in providing information on what matters to them. And secondly, a dedicated process that the clinician can use to explain the options to the patient, if you like, a form of decision aid. The first, About Me, relates to listening to the patient and encouraging them to ask questions, to be active rather than passive in that conversation. Finding out what matters to the patient about their own health, their wishes and fears, What activities contribute to their quality of life so that the impact on their life, for example, following treatment or not having treatment, can be understood by both parties. It helps to explore the patient's needs, their values and priorities that influence their decision-making process. And secondly, a generic shared decision-making standard or tool must allow the patient to understand the options available to them and help them make a choice that is right for them. And this process, of course, continues throughout the patient's journey from first contemplation, when they have a medical problem, to full recovery. One such aid is known by the acronym BRAN, which stands for Benefits, Risks, Alternatives and Doing Nothing, which of course should always be a choice for a patient. It is here that the patient is given sufficient information to come to a decision which is best for them, often in combination with additional conversations with family and friends. Let me tell you how the shared decision-making consultation for Mr. and Mrs. Williams proceeded once About Me and BRAN had taken place. Well, Mrs. Williams, if I could summarise, although you feel that the hip operation that we discussed is the best option for you, you've also chatted with me about your current circumstances. You mentioned that you were booked to travel to Australia to see your daughter and your grandchildren in 2 months' time, and that this was likely to be the last big international trip that you and your husband expect to make. So that is a big priority for you. So having looked at the benefits, the risks and the alternatives, as well as considering not doing anything, you've chosen to defer the operation until the autumn so that you can visit your family. We will arrange a short-term steroid injection along with painkillers to help you have that important holiday, and then look to book you in when you return to the United Kingdom. I'm happy to support your decision, having spent time understanding the options and the choices open to you, and recognising that you've been able to make this decision in a way that's best for you at this moment. Hopefully, this short video has helped to illustrate the shared decision-making process and how it can be central to both patient choice and allowing the clinician to fully understand the best decisions for that patient. And also those key words and phrases: options, choice, about you, and outcomes. Shared decision making at its heart is a conversation.